I've just entered my patient's room. I've washed my hands and I have shut the door behind me to ensure plenty of privacy. My name is Kelsey. I'm going to be your nurse today.
Sure.
Can you just verify with me your name and your date of birth?
Sure, it's Brianna Chassa, and then my date of birth is 01/25/1997.
Perfect. And I'm just going to match this up with your wristband really quick, okay?
Sure.
Which it matches perfect. What brings you in today?
I just fell and hurt my knee a couple days ago.
Okay. What were you doing?
I was just outside doing some yard work.
Yard work. Okay. Not decorating for Christmas?
No.
No. All right. So we'll take a closer look at your knee once we kind of work through the assessment, if you don't mind.
Sure.
And I'm just going to get your vitals, and
Sure.
we'll start with that, okay?
Yep.
All right. This will go on your opposite hand. Gets your pulse and your oxygen. And I'm just going to get your temp first.
Sure.
98.6. Perfect. Blood pressure is 120/80. And respirations of 14. And your oxygen is 98 and your pulse was 82.
Sure.
All right, so what I would like to do first, now that I've gotten all your vitals and everything, I just want to kind of start at your head, kind of work my way to your toes, and you just kind of let me know if anything else is bothering you. I just want to kind of inspect, make sure everything looks okay.
Sure.
I know that your knee is bothering you, but we want to check everything.
Okay.
So, okay?
Sure.
All right, so I'm just going to kind of feel around in your head. Let me know if anything is sore, painful, or bothers you. Any pain?
Nope.
So I'm feeling around on my patient's scalp. There's no deformities, no lumps, bumps, sore spots, no patches of hair missing. And now I'm just gonna kind of take a look at your skin on your face. Temperature feels normal for a patient. She doesn't have, she doesn't feel really warm or too cool. Her skin is normal for her ethnicity, nice pink undertone. She's not diaphoretic or, anything like that. So I'm just gonna check kind of your pupil reflex, okay? So I'm
Sure.
gonna use this light.
Yep.
I'll have you look at my finger.
Yep.
I'm just gonna bring the light in from the side. Perfect. All right, and I'm just gonna kind of take a look up your nose, make sure everything looks nice and clear, which obviously it's not totally clear because I can tell you're not feeling so good.
Just a little strep. Not COVID.
Pupils were equal and reactive to light and stimulation. And symmetry is good on both sides of the face. Everything looks nice and equal. Can you smile for me? Perfect. Can you stick out your tongue for me? Tongue is midline. It's not drooping from one side to the other. Can you just open your mouth for me so I can take a look? Teeth look good. Oral mucosa is nice, pink, moist. Tongue is good. There's no blockage. And how are you doing with swallowing?
Perfectly fine.
Perfectly
No issues.
fine, no problems.
Mhm.
Okay. Can you just swallow for me? Perfect. No problems with that. And I'm just going to take a look at your ears really quick.
Sure.
Ears look good. No blockages. All right. And so now, if you don't mind, I'm just going to check your arm movement and see how things are with that.
Sure.
Can you take both of your arms and kind of bring them out to your side?
Yep.
Yep. And then bring them back in. Then raise them up in front of you. Kind of rotate them and then bend them up and flex them back out. Any pain with any of those motions?
Nope.
No. Okay, so she's got equal 5 out of 5 in her strength with both arms, and no pain on either side. Do you mind if I just kind of check your capillary refill?
Sure.
Okay. Capillary refill is less than 2 seconds. Both. Perfect. All right, we might as well check the toes while we're at it. Capillary refill is good. All right, and I'm just gonna, do you mind if I take a listen to
Sure.
your heart and your lungs?
Yep.
Okay. I'll have you sit up for me.
Sure.
All right, you can lay back down for me. And now I'm just gonna take a listen to your heart real quick, okay?
Sure.
Listening to the aortic. Pulmonic. Herb's point. Tricuspid. And the mitral. Just gonna feel your pulse just to see if there's any pulse deficit. Good. No deficit. So lungs were equal on both sides. There was no rhonchi, stridor, anything like that. Lung sounds were nice, clear. Everything sounded good. As far as her heart sounds, everything in each area sounded good as well. She had no deficit between her pulse. And now I'm just gonna take a listen to your abdomen and
Sure.
just see, make sure everything is working okay and sounds good, okay?
Sure.
How have your bowel movements been?
Pretty regular. I go once a day.
Once a day?
Yep.
Okay. And sorry for being kind of like nosy, but what does your stool look like?
It's brown usually.
Is it formed,
Yep.
loose, anything like that? It's formed?
Yep.
Okay. And you haven't had any abnormalities with going to the bathroom? It's not an issue?
Nope.
How about urinating?
Fine.
Fine. How often do you go?
Probably 4 or 5 times a day.
Okay. Any difficulty with urinating?
Nope.
Any pain, burning? No?
Nope.
Okay. All right, so I'm just gonna take a quick listen. Alright, all the sounds in the abdomen were good, not hyperactive or hypoactive, it was all normal. So now that I have kind of taken a look at your abdomen, I'm just kind of gonna work down to your legs, okay?
Sure.
Do you mind kind of moving one leg out and then back in? And then do the same thing with the other one, perfect. Any pain, discomfort with that?
Not really.
No, okay. Can you flex your toes up? Can you point them down? Can you turn your ankles in and out? Perfect. Can you bend your knees, both of them?
Yep.
And this one hurts a little bit more?
A little bit, yeah.
Okay. All right. So I'm just gonna kind of feel your legs, see if there's any swelling or anything like that. Let me know if anything hurts.
Sure.
Legs feel fine to palpate, no edema, no swelling. I'm just gonna feel your pedal pulse. tibial pulse. And I'm just gonna feel your pulse up on your wrist,
Sure.
if I can do that. Yep, so we'll do the radial, and I'll do the other hand too, but we'll do the radial and the brachial. And then I'm just gonna do your carotid, okay?
Sure.
Do the other side. Perfect. Pulses, I would give them a 3+. They all feel normal. They're not bounding. They're not weak. They're normal and good. Also, as far as her lower extremities, I would give that a 5 out of 5 with strength and mobility. I'm just gonna have you pull your toes up for me. Yep, and then push back. Perfect. Strength, mobility of her lower extremities are good. No, they're both very symmetrical. There's no issues with one side versus the other. Do you mind if I just kind of have you turn over and we'll check and see your backside, make sure there's
Sure.
no sores? Is there any pain or anything when I do any of this?
Nope.
No. Okay. All right. You can roll back over. Perfect. All right. And so with your knee, you said you fell a couple days ago.
Yep.
And you said it's kind of bothering you today.
Yeah.
What would you rate it on a scale of 0 to 10?
Probably like a 3 or a 4.
3 or 4. Could you describe the pain for me? Like what it feels like?
Just like a dull ache.
Dull ache. Okay. Have you taken anything to help with the pain?
Just some ibuprofen, yeah.
Okay. How much ibuprofen?
4 of the 200 milligrams.
Okay. And how often are you taking medication to
Like
help
once a
you?
day.
Once a day?
Yeah.
Okay. And that seems to get you through the day okay?
Yeah.
Feels all right?
Yeah.
All right. Any creaking, popping, snapping when you're walking or bending your knee?
Nope.
No? Just kind of feels tight, painful?
Yeah.
Yeah. Okay. All right. So maybe we can see what the doctor can do. We might be able to order some, an X-ray, see what's going on. Hopefully it's, it could just be you bruised. So, so at this point, I'm going to give my patient her call bell. I will set her in the upright position, however she's comfortable, and I will make sure to wash my hands and then go and document my findings.